Well, women in Nova Scotia will now have access to new and potentially life-saving information.
Yes, they will now be able to learn whether they have dense breasts with the results of their mammograms. The density can affect a patient's risk of cancer and how easily their cancer can be detected. Dr. Paula Gordon is with Dense Breasts Canada. We've reached her via FaceTime in Vancouver. First of all, Dr. Gordon, your reaction to the news that Nova Scotia is now going to notify patients about breast density with their mammogram results.
This is absolutely wonderful, and we need the other provinces to get on board too. We have to thank Premier Stephen McNeil, but we also have to poke the other provinces that are not quite so quick on the uptake, like Ontario, Quebec, New Brunswick, Newfoundland, and Manitoba.
Well, why is it so important for patients to have this information?
Knowing what your breast density is not too much different than knowing whether you have high blood pressure. So there are two risks associated with having dense breasts. The first is that women need to know that their mammogram is less accurate, and they should be doing breast self-exam to check their own breasts, get to know their lumpiness, and they'll spot if there's a new lump quicker than, say, if they bump into it by accident in the shower one day. And the other risk that women need to know is that the higher the breast density, the higher the risk to get breast cancer.
Now, do you think many women realize the role density can play?
Absolutely not. We need to inform women. We even need to educate physicians. Most family doctors are unaware of the importance of breast density. Now, and that's why women need to be informed on their mammogram. We can't just put it in a report to a physician, because if they don't know that it's important, they may not communicate it to the woman.
Now, what percentage of women have dense breasts?
If you count, so we divide breast density into 4 categories, A, B, C, and D. The top 2 categories are regarded as dense breasts, and about 40% of women over the age of 40 have dense breasts.
Now, you've talked about encouraging other provinces to step up and do the same. Where does Nova Scotia rank in terms of getting this information out? Are they a leader?
Nova Scotia is the 2nd province to notify women. British Columbia started notifying a little more than a year ago, but Nova Scotia is the first province to use automated density assessment to determine what category a woman is in. In British Columbia, we still use the subjective method where I, as a radiologist, look at the woman's mammogram and I say, she's a C or she's a D, whereas the software does it automatically and it's more objective.
Mm-hmm. Now, have you encountered any resistance to this, whether it's for medical or financial reasons?
Nobody ever says that it's financial reasons, but that's got to be part of the equation, because in addition to notifying women that they have dense breasts, the next logical step, and I hope Nova Scotia will take it, is that women with dense breasts will be offered supplementary ultrasound screening over and above their regular mammogram, because we know that when we do ultrasound in women with dense breasts, we find those small, invasive cancers that were missed on the mammogram, and we find them not only when they're small, but when they haven't yet spread to the lymph nodes, and that's critical for long-term outcomes.
All right, some important information. Dr. Gordon, thank you so much for your time today.
You're welcome.